All right. So thank you again for coming, everyone. If you can just introduce yourself in the chat so that we can have that on record of who is in attendance today, that would be awesome. I'll just kick us off with our land acknowledgement. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we're on unceded territory of the ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nation, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, ongoing systemic inequities, while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, self-governance, and the self-governance of New Mexico's tribes and nations who are still here today. And then the last thing I will note is that we have our second session of the peer-led learning series is coming up on Monday, the 18th. Margaret Chavez and Enrique with Margaret with Hildago and Enrique with Bernalillo Health Council will be presenting on how to engage members and other partners and how to reach harder populations in your community. And then we will be staying on for 30 minutes after if any health councils have questions about getting on Mighty Networks. We'll probably do another little overview of Mighty Networks and be available to answer any questions and guide you through anything. All right, I will stop sharing and pass it over to Nancy.
Thank you, Rebecca. Let me pull up my PowerPoint so you guys can see. I am Nancy Rodriguez. I'm the Executive Director of the New Mexico Alliance for School-Based Healthcare. And I think that there are a couple of you at least that I've had the pleasure to meet, but some of you may be new to our organization and new to school-based health centers generally. So I'm going to talk a little bit about our organization, what school-based health centers are, and how in the past we've worked with health councils and how I'd love to see us work with health councils in the future. And how the aim of that is to address child and family health care gaps. So these are just some of those categories. Our organization is a 501c3 organization that's been around for about 22 years in New Mexico. We started out as a volunteer-led organization, and then were housed at Voices for Children and eventually spun off about 22 years ago as a 501c3 because our state has had school-based health centers for about 30 years. And we mostly focus on school-based health centers, and I'll talk about what that is in a minute, but we also collaborate with other partners more generally on school health, promoting, facilitating, and advocating for comprehensive, integrated, and culturally competent healthcare, including health education in schools. So we work with the New Mexico chapter of the National Association of Social Workers, looking at school social workers. We partner with the New Mexico School Nurses Association and so forth to try to focus on school health more broadly as well. We are an affiliate of a national organization. Both are standalone 501c3s, but there are about 25 states now that have organizations like ours. Not all of them are staffed. Some of them are still volunteer organizations, but that are affiliated with the School-Based Health Alliance, which is a national nonprofit that does some of the same things we do: training, technical assistance, advocacy, and policy work on school-based health. And I'm actually on the board of the School-Based Health Alliance as well. And we are, and one of our major funders is New Mexico Department of Health Office of School and Adolescent Health. They're the sort of the primary funder of school-based health in our state. School-based health centers bill Medicaid and private insurance, so that's a big part of their income. But also there are grants and contracts with operators of school-based health centers through the Office of School and Adolescent Health to help support their operations. And they also have a contract with our organization to provide technical assistance to school-based health centers. Another thing that we do is create and disseminate tools for the school-based health field. So our website is in this PowerPoint and I put it in the chat. So we have a number of tools on there that anybody's welcome to use. And some of those are school-based health specific, but some of them are not. Some of them are just pediatric health, everything from asthma to diabetes to, mental health. So you're welcome to pull any resources off our website or ask us if we know of resources if youth and family health issues come up and you need tools. And then we also work with state agencies to do policy making and advocacy and even a little bit of lobbying for the school-based health field at the state level. And then we partner with SBHA to do that on a national level as well. So what are school-based health centers? If you haven't been in one and you ever want to take a tour of one in your county, please let me know. I think we only have 2 counties right now that don't have school-based health centers, and that may change in the next couple of years, hopefully. There have been times in the history of our state where every single county had school-based health centers. So we're trying to fill some of those gaps over the next few years. But school-based health centers are essentially a healthcare clinic located in the school that provides an integrated model of care, which means they provide both primary and mental health services. Some school-based health centers provide that only to the students at that campus. Others can provide it to members of the community, and there's a lot of models and everything in between that kind of situation, but always with the integrated model of both primary physical care and mental behavioral health care. Additionally, school-based health centers are often called upon to provide other expertise and resources to the community. So it's not uncommon, as an example, for a school health teacher to ask a school-based health center to come in and do presentations to classrooms on health topics if they've got more clinical expertise on that. And they collaborate with school nurses, school social workers, and those other school health partners to help meet those additional needs of the school community. And sometimes those are just preventive health education topics, like I mentioned, and sometimes they're crisis management, whether that's a suicide on campus or of a student who's part of the campus community, or school shootings, that sort of thing. Those are the other things that school-based health centers help their school community with. And the goal is dual. So we have kind of, as an organization, we have a foot in healthcare, and I'd say we have a heavier foot in healthcare, but we also have a foot in education. So we work with both public education department, teachers, et cetera, as well as healthcare entities, because our goal is that school-based health centers improve both health and academic outcomes. This little graphic that's on this particular page shows you which counties, and this is all retrospective. I will tell you some of what I'm going to share with you today is from this last school year and even further back, because this is the time of year that we actually do an updating of our directory. We do have a directory on our website of every single school-based health center in the state. And that is, at this point, retrospective to this last year. It's actually going to increase, and I'll tell you about that in a minute. But this tells you what it looked like last school year. 79 school-based health centers across the state, 54 of those getting DOH funding. And so we have more data from those that get funding from the Department of Health in terms of what kind of care is being provided and so forth. But typically, acute care is a big part of what school-based health centers provide. Behavioral health has been obviously a growing need. I'm sure you guys are familiar with the state of emergency that our National Surgeon General announced around adolescent, in particular adolescent and child mental health. So that has been increasing over time. Comprehensive wellness exams, immunizations, diagnosis and treatment of chronic disease. Asthma is a significant burden. Diabetes is a significant burden in New Mexico. So we see a lot of that in school-based health centers. And then where allowed by the school district and school board, reproductive and sexual health care. As of last school year, we had 48 high schools, 11 middle schools, 4 elementary schools, and 16 combined grade campuses. That represents all brick and mortar school-based health centers. In the next year, these numbers are going to increase, and a part of that increase due to additional funding through the legislature will include an increase in telehealth only school-based health centers and mobile school-based health centers. that is a gift from COVID. People are willing to accept telehealth in ways they never were before. And, thanks to a lot of mobile efforts around vaccination and testing to COVID, mobile clinics are also a growing trend nationally and in New Mexico. So we're going to see that here for school-based health centers as well. In terms of who runs school-based health centers, and this is really confusing to folks, because it's different in different states. In our state, about 15 years ago, 16 years ago, Department of Health sort of made a decree, which is that schools cannot run their own school-based health centers. And that's mostly to keep sort of the HIPAA and FERPA stuff separate. And so that it was easy to provide money through Department of Health to healthcare entities. So the way it works in New Mexico is a school district partners with a community health entity. And this is 63.9, but it's getting closer to 65 and 70% of our school-based health centers in New Mexico are run by federally qualified health centers. And that varies across the country. In West Virginia, 95% of their school-based health centers are run by FQHCs. In California, schools still run school-based health centers. So it's a little bit different depending on the state. And then the rest of the percentage is a mix of hospitals, regional educational cooperatives, IHS and tribal governments, and universities. So it depends on, what community you're looking at, who runs that school-based health center, but that is a part of what's on the directory in on our website. Next up, I just wanted to share this is some information we collected from school-based health centers over the last year to provide information to our legislators. Those that get funding from Department of Health have to not only submit data about what kind of medical encounters they have with patients, but also they do a student satisfaction survey, and they do a survey of their school partners to see what their experience has been like. So the data that you're seeing in these percentage points are based on that data that is submitted. So that's of the 54 that are Department of Health funded. So for example, sort of top of the line, 59% of visits to school-based health centers are for primary care. 12% of kiddos say if they had not gone to their school-based health centers, they just wouldn't have gotten health care, period. Another 25% said that they would have gone to urgent care or in an emergency room, which is obviously a significant cost to the healthcare system and not the most appropriate place for kiddos to be getting healthcare. Interspersed through this data, and I'm not going to read all this to you aloud. I will send this, maybe Rebecca, I can send it to you, and then if people want access to it, or you can email me if you want the PowerPoint. These are success stories that people have submitted, either coordinators or students or school staff or parents. And this is not necessarily the hot off the press news that gets in the media, because good news is hard to get in the media, but mostly what we hear are, thank goodness you're here, because we would not have had access for our kiddos to healthcare, or I would have had to take a half day off of work to get them to an appointment and that sort of thing. So I obviously have drunk the school-based health center Kool-Aid, so you can take it with a grain of salt what I say, but this is direct from the horse's mouth in terms of the people who are in the field working with school-based health centers. The next slide tells you a little bit about what specific kind of care is provided in school-based health centers. This first bar chart is from last school year, and then the pie chart is from the 4 school years before that. So as you can see, as I mentioned, the greatest part of the visits at this point is still a majority primary care. We have seen that going from sort of like 39, 40, 41, 42, 43. I bet you this year it'll be closer to 50% being behavioral health care, but at least over the last few years, we have been steady kind of at a 60-40 primary care to behavioral health care. And of that primary care, general wellness and urgent care are the biggest part of the what a school-based health center sees. So this general wellness is a combination of I'm going to set an appointment in advance for my school sports physical or my comprehensive wellness exam, as well as urgent care. And then we sort out ear, nose, and throat, because especially seasonally, that is a big part of what school-based health centers see kind of from October to February. Keeping kids, deciding if they need to keep kids in school or if they're contagious and they need to go need to go home is a big part of what they do. And then the rest of these contraception, illness or injury, chronic disease, immunization, STIs, gastro issues, other kinds of reproductive health, which could be serving expectant and parenting teens with prenatal care, and then rashes. I was at Atrisco Heritage High School School-Based Health Center last week here in Albuquerque, and they had 10 kids between the School-Based Health Center and the school nurse's office throwing up in buckets. So last year and this year, norovirus has kind of bumped up the numbers in the gastro. That's why that's pulled out here. I think a lot of things have come roaring back after COVID. Kiddos' immune systems are a little bit suppressed because they were at home for so long. So we've been seeing a little bit more on the urgent care of side of things. And then you can see that trend is sort of similar over the last 4 or 5 years. Here's some more success stories that we have heard from school-based health centers. One is about telehealth. Telehealth really blew up. I think before the pandemic, we had across the state 6 telehealth visits at school-based health centers. And then during the pandemic, that it went up to the thousands of telehealth visits. That's tapered off again, but we are going to see another increase as we open some of these tiny rural communities. They really don't have enough of a population to sustain a brick and mortar school-based health center, but they can sustain telehealth services. So I think we'll see that go up. The second one there at the top is about anxiety and suicide ideation. We definitely in the behavioral health, that 40 to 45%. Anxiety has certainly gone up since the pandemic. Depression used to always be higher, and now they're sort of neck and neck. And I think probably anxiety is going to go up over depression, particularly among teenagers, between worrying about, their parents, going to work and potentially catching COVID to, just not being used to being around other students for a year and a half. We've definitely seen an uptick in anxiety. And then the bottom two are some more like long-term care things, and are the kind of things that we hear about a lot. BMI and obesity is very high in New Mexico. And so a lot of school-based health centers do a lot of special, everything from sort of the clinical things about, doing blood workups on students to see if they have high cholesterol or are pre-diabetic, to running walking groups and using community health workers to try to do behavior change around eating and exercise. So that's definitely something we see. And then the far one on the right is the kind of stuff that keeps me up at night. We have had a lot of teenagers come into school-based health centers who had pediatric care when they were really little. When you have the pediatrician that you're attached to after you deliver your baby, and then you have all those required immunizations. But then there is very typically a gap in care where parents then don't take kiddos in for like an annual well visit. And teenagers are typically very healthy, but what happens is when that gap happens, and children's bodies grow, we see scoliosis, we see cardiac kind of disorders, heart murmurs, that sort of thing. And so there's a lot of time, cancer we've had diagnosed in school-based health centers. So a lot of times school-based health centers catch things that really could have been fatal or at least life-altering for young people and their families, because there's been a gap between that early childhood period and when they become teenagers. So for the schools who don't have school-based health centers, I pray they have school nurses who will catch these kind of things. But I think the work you guys do at health councils is so important to encourage families to keep going, even when kiddos are healthy, to get those annual wellness visits if they can find a place to get them done, because when those bodies are growing in puberty is a lot of times when practitioners can find things like that. So I mentioned that school-based health centers are expanding over this next year, and that is sort of a work in progress right now. For the first time in many years, there was a major investment at the legislature. There was an increase to the Department of Health's funding to the tune of about $4 million in this last legislative session. And that then went to an RFP process the Department of Health ran, and they are in the process of executing contracts right now. And they're going to go from 54 school-based health center contracts to 140, which is very large. Now, I will tell you I'm not going to say that's artificially inflated because that's a true number. But what it's not obvious is that doesn't mean there's going to be 140 new buildings that are on campus clinics. There's about 20 sites that are going to be telehealth only, or a combination of what we call the hub and spoke model, where maybe they'll physically go out there 4 times a year and then it'll be telehealth in between. There's another 7 that are going to be mobile school-based health centers. So as an example, and actually this is through federal funding, but DeBaca Family Health Center got some federal money to do mobile services because there's a lot of small rural school districts in their service area. And so they're going to be going to a lot of small schools with some regularity with their mobile unit. The other thing we have a lot of in New Mexico, since we are such a rural state, is multi-age campuses. So the other thing in that number of 140 is campuses where the physical, I'll use Mora as an example because they've been open for a long time. They've got early Head Start all the way up to 12th grade, sort of in the same physical space in Mora, but technically they do have an elementary school, a middle school, and a high school, but they can all 3 go to the same clinic. So you're serving 3 schools with 1 physical clinic. So we have some of those as well. They're going to be growing in the rural part of the state. So these are, but these bullets just represent how we've worked on that. So the number of school-based health centers actually went down during the recession and during Governor Martinez's tenure, which those 2 things overlap. And some of you will maybe remember that we had some school-based health centers close. I'll use Belen as an unfortunate example in Valencia County. The Valencia County Health Council was miraculous in their attempts to get that school-based health center at Belen High School reopened. And that's an example, and we're going to talk a little bit more about this in a minute, of how county health councils can be really instrumental in supporting the presence of a school-based health center in their county. There still isn't, unfortunately, a school-based health center at Belen High School, mostly because there has not been a medical entity who's been willing to step up to the table to operate one, even now that we have money there. So these are the ways we expand, are also sort of the same ways county health councils can help us get more school-based health centers out there. We have to advocate with school, local, state, and federal officials to get more school health services in schools. We have to advocate with funders to fund those school-based health centers, whether it's the state, the federal government, members of Congress, or local foundations. We have to encourage local healthcare entities to be willing to open school-based health centers. The Valencia County Health Council and our organization talked to Presbyterian, talked to First Choice, talked to every Tom, Dick, and Harry who would talk to us in Valencia County to see if any of them would be willing to run that school-based health center if we could get funding for them, and it did not move ahead. But before I die, I hope we'll see another one there. I have a few of those before I retire or die communities that I've got my eye on. So we're happy to talk to any of your individual councils about that. And then finally, one of the biggest challenges right now in school-based health is staffing. And I'm sure that's something you guys have already talked about in your councils. So one of the things that we always encourage our school-based health centers to do is talk to their young patients about whether they'd be interested in going into a health care field. We do have some pipeline programs in New Mexico that support young people who are interested in going into those fields, and we need more kiddos to consider that, because the rest of us are getting older and we need them to take care of us as that happens. So those same things that have sort of led to how we've been thinking about expanding are also how health councils can support expansion of school health services. So in any communications you guys have with funders and with officials, please do encourage them to look at and invest in school-based health centers, in school nurses, and school mental health providers. When you're working with school districts, if you see that they are battling things that are health related, and sometimes that's not transparent. Like we have a significant one. Unfortunately, we were in the New York Times recently for how chronic absenteeism is a problem. And it's a problem across the state since the pandemic, but it's a big problem in New Mexico. We're sort of at the top of that list, unfortunately. So there's things that look like education problems that are really healthcare problems. And then there's obvious healthcare problems. So as school districts look to improve their outcomes, encourage them to consider student and family health. When you talk to funders, encourage them to invest in school health. When you're talking to Presbyterian, to local hospitals, to local health plans, FQHCs, encourage them to get in the game of school-based health center, and we can provide technical assistance to them if you guys think they're willing, and talk to them about how that works. And I think, I buried my lead here at bullet 2, but some of you may be familiar with some problems here in New Mexico and nationwide, with folks having, really believing misinformation about school-based health center, up from the anti-vaccine and anti-masking and sort of school choice movements. A new parents' rights movement has come up in our country and in our state, and that has resulted in people asking questions and sort of believing misinformation about what actually happens in school-based health centers. Some of you may have seen that with Department of Health leadership and some legislative champions, there was a bill that defined and codified school-based health centers that passed through the last legislative session. And there were a lot of sort of conspiracy campaigns about this idea that happened in the same legislative session as laws about abortion and gender affirming care. So there must be a statewide conspiracy to have school-based health centers do gender transition surgery and abortion, which I'm here to tell you they do not do. The federal definition of a school-based health center includes that they do not provide abortions, but there has been a significant misinformation campaign here in New Mexico by the referendum effort, which includes the school-based health center bill and some voting rights bills and the gender affirming care and abortion bill, that have sort of tied school-based health centers to those issues, which has been really unfortunate, and has led to some local controversies in your communities at the school board level. And then there's national efforts, that are related to that and include efforts to overturn adolescent consent and confidentiality laws, which we have here in New Mexico and which school-based health centers follow. So if there are things that you hear about school-based health centers in your communities and you think they fall into these categories of misinformation, please set those folks straight. School-based health centers do not provide abortions. School-based health centers are not surgical centers of any kind. So not only can they not provide an abortion or gender transition surgery, they can't operate on a finger that's dangling that a kid closed up in a classroom door, or any other kind of surgery. They call ambulances for those sorts of things, or refer families to other kinds of clinics that do surgeries. And then if folks have questions, the consent issue is a little bit more complicated because it's based on state law. And so we usually refer folks, we have some information on our website, but Pegasus Legal Services for Children has a really good guide to adolescent consent and confidentiality on their website. So that answers questions about what is legal under the law. That is no different at a school-based health center than if you took your kid to a Loveless clinic, a Presbyterian clinic, an FQHC, wherever. The state law is the same, no matter where young people get their care. But you're welcome to refer folks to us if they have questions about consent and confidentiality, because school-based health centers do follow that law. But there's a lot of confusion about that and a lot of fear. And I'm not going to say that, everybody that's got questions has got some nefarious purpose in mind. There are some people that do not care about the truth, and they do have political or financial goals when they spread information. But the pandemic was a scary time, and I think there's legitimate questions based on fears that parents have about what kind of care kiddos get. And I am happy to answer questions if you guys have community members that have them in good faith about that sort of thing. So last thing is I would say is we are happy to answer questions in today's presentation, but please write my email down, which is actually on this next screen, and then in the chat. As you guys go forward, I know I've always been impressed with what county health councils do to talk to their communities and even survey communities about what the healthcare needs are. If you ever want to send me an email and say, hey, Nancy, asthma's off the charts with kids in Otero County. What can you guys do to help? Or can you connect us to other partners? Or, hey, Nancy, we agree. We're going to have a school-based health center in Valencia County before we all die. Let's have a meeting and talk about how we make that happen. I am happy to entertain any of those conversations, questions, requests for resources. So I hope you'll ask me whatever questions you have for today, but also keep my information, and myself and my staff, all our emails are on the website. So if you ever lose this and you need to find us, just Google us and you can find our information on the website. So in addition to questions, if there's anything you know that you're already seeing in that school age population that you want to share now, if we have time, Rebecca, I'll let you guys help me manage the time and maybe even questions in the chat, but I will be quiet now and try to have a conversation around this stuff.
Yeah, we have plenty of time for questions. Looks like we do have one in the chat. Ken asked how many tribal school-based health centers exist and where are they?
So right now, San Felipe runs a school-based health center and Laguna runs a school-based health center. Laguna's been around for a long time. That's the junior senior high school. And the tribe took over operations of that themselves, but it's been run by PMS previously and UNM. And then Northern Navajo Medical Center provides some school-based health centers up in the northwest part of the state. And then we have a few Fort Wingate is in the process of working on a school-based health center. And then there's some that are sort of like almost a combination of mobile and a brick and mortar school-based health center that IHS runs in some of it. They don't actually run Gallup, but north of Gallup up into Shiprock and Sayguy and so forth. And what they do is they don't have a mobile unit that goes out. They have a physical place in some schools, but they do it sort of on an appointment basis, and IHS sends out providers on appointment. So they don't do as much urgent care as some like people who are planted, but they send out providers when they have appointments. But I think that number is scheduled to go up in this next school year. I don't have that data in front of me because the DOH won't release that until contracts are executed, but I think that's going to go up. But I think there's room for more for sure. Oh, and I see someone has a sort of a statement, but it's also a question about 3 that closed, and I'm assuming that's probably Roswell. La Casa Family Health which is an FQHC, was running all 3 Roswell school-based health centers, as well as some in Clovis and Portales. They only had money from DOH for those 3, but they do some things in Clovis and Portales. They have some, I mean, I hate to talk about somebody behind their back, but that's really to do with their own financial challenges as well as challenges in finding providers. So we are trying to work with them, and they are trying to work with the district to maybe make a comeback and get some money to come back into those schools. And we've made a couple of recommendations to that, and we have volunteered if La Casa cannot come back to try to find some other community partners. We've talked to a pediatrician who has a practice in Roswell, who's a supporter of school-based health centers. So I am hoping that maybe by second semester that will come back in Roswell, because there's certainly a need there. La Casa actually had a planning grant from us last year to open a new school-based health center, a 4th school-based health center at a middle school in Roswell. So they know the need is there. It's just kind of putting together the funding and the provider network to do that. So I'm trying to see who. Joanne, write my number down. If you would be willing to help us put that back together, I would love to talk to you about how you can help. Is there any funding for new school-based health centers? So Yes and no. DOH I mean, I know health councils get money from DOH, so you know this already, but it's like trying to move the gorilla because they're such a large department. So they were supposed to have executed contracts with school-based health center operators as of July 1st, and we still don't have them, and it's September 15th. So in theory, those RFAs went out in April, and all of that money would have been spent. I think they're going to have to wait until those contracts are fully executed to see if they have any leftover money. If they do have leftover money, next spring, there will be another kind of add people into that contracting process. They have given us a little bit of money to run another like smaller planning grant process this school year. And that money is used by either the district or the medical entity, whoever applies for our planning grant process, to do kind of what health councils often do, have discussions about what the community need is, and who's the best partner to fulfill those needs. So if you know in your county that you don't have a school-based health center, but you want a school-based health center, feel free to reach out to me and we can kind of add you to the list. And then when we find out if Department of Health has money and we're waiting for that to open up our planning grant process, then we can reach back out to you guys to advertise our planning grant process, or tell you that, tell your school to start reaching out to DOH. Has Ben Archer been contacted to provide school-based health centers for Sierra and Doña Ana County? Technically, Ben Archer runs school-based health centers in Sierra and Doña Ana County. Ben Archer runs Tier C, which is kind of a funny, it's more like a school linked clinic because it's down the street from the school. They're in Tier C, and then they run some, like the majority of the school-based health centers in Cruces with the LCPS. La Clinica de Familia also runs school-based health centers in Cruces and then in Southern Doña Ana County. Ben Archer does not get money from the Department of Health to do that. And, Rita, I don't know if this will be a surprise to you, but Ben Archer does what Ben Archer wants to do. And that's part of the reason they don't have Department of Health funding. They have a very large endowment, so they have the freedom to do that, which is great because then that leaves more Department of Health money for other people. But we don't necessarily have a lot of influence over Ben Archer, nor does DOH, because of that. And so some of their school-based health centers have closed. I know LCPS is not in love with the minimal hours that they provide at some of those school-based health centers. And then in Sierra County, the district, and I'm just being really frank with you guys, so hopefully you won't go tell on me to Ben Archer or any of these other entities, but I don't think this is news to them. The district in Tier C has not been thrilled with, because it's physically hard for kiddos to get to the Tier C clinic. They haven't sort of been in love with that operation. So we've talked over a number of years about trying to figure that out, but I am not the boss of Ben Archer, so that has been challenging. So if you have influence and connections in Ben Archer and you would want to broker conversations about that, I would be more than happy to participate. Trying to see if there's anything else in the question.
We do have a hand up. John, you want to go ahead?
Well, I was just going to say, Nancy, if I could reach through the screen and hug you, I would, as the Southwest Region Health Promotion Program Manager, because I think being frank and having frank conversations is really, really important. And I think what you just said, I think this is an area where, and I'm not speaking with my DOH hat on right now, okay? But I think it's in my opinion, as a parent of Las Cruces public school aged children, as the working in this region and throughout this county, is I think, yeah, how do we engage our health councils or our communities and our schools, and how do we advocate for better support systems that not only support our students, right, but the parents, and then the teachers, and then we also, something else that I think is, I just wanted to give another editorial on that for people to think about, is the lack of school health professionals. And you touched on it with staffing, right? But we don't have enough nurses. We don't have enough trained social workers. We don't have enough school counselors. And all of this taxes our teachers. And then we don't even recruit, train, and retain enough teachers, right? So I think it's a bigger systemic issue. So I think collaboratively and collectively, I think this is a space where I think health councils and really communities as a whole, with your support, with your agency, I mean, I think this is a really good example of a partnership where, you know, how do we move the needle? So I just wanted to throw that out there. Sorry for the rant and the ramble, but I just wanted to thank you, Nancy, for really educating and again, kind of informing this group on, you know, it's not for a lack of effort. Sometimes it's based on that. We talk a lot about social justice, right? Power and control. And when we've got, you know, that underlying, it's very difficult.
Well, I appreciate that, John, and I accept all hugs from child health advocates. So when we get to meet in person, I will take you up on that. And I think we have to support each other in that way, because none of this is easy. I mean, I said before, we've got a foot in healthcare and a foot in education. Nobody's becoming a millionaire working in public health, and nobody's becoming a millionaire working in public education. So we're asking the most underpaid, overtaxed systems and people to make significant change to help our kids and families. And that none of this is easy. So that's why part of why I do feel comfortable speaking frankly about what the challenges and problems are, because I have not met an evil person at any of these institutions. Everybody is paddling upstream. And so, you know, I feel like both with, you know, the Alliance of Health Councils and NMPHA, we all have to work together, because me paddling upstream by myself is nowhere fast. So, I mean, we've got 4 employees in our organization. We are a tiny nonprofit. So we really need to collaborate with you guys and other partners in the community so we can all paddle in the same canoe and maybe get somewhere together. And we don't certainly have all the answers. So if you guys have other ways we can do that, then please do let us know and call upon us. And I think Valerie had her hand up next.
Hi, yeah, thank you so much for that presentation. It was really informative. I'm wondering a couple of things. So how do we know if we I guess maybe I can answer my own question, maybe talking with NMDOH professionals, we can find out if we technically do have a school-based health center within our community, because I know that there's probably certain things that go into that, and I know that we do have resources here in Grant County for that, but I don't know if there's technically a school-based health center. So that's one comment I have. And then the next thing is, as I would be really interested in hearing some perspective on, you know, things, how health councils or other entities have engaged with school-based health centers in the past that have been, you know, proven to be a success. And then also, you know, the process in improving those systems, because we have the partnerships at the table here in Grant County with our school partners, but we want to really be an asset to them and help them in ways that are, you know, that are productive. So any sort of advice that you have on that would be really good. Thanks.
Oh, I think you're muted, Nancy.
Thank you. You'd think 4 years of practice would have taught me better, but in any case, so we do have school-based health centers in Grant and Hidalgo County. We have been working with HMS for a long time. They've run school-based health centers. So Silver High School and Cobrae High School have school-based health centers, and Lordsburg High School has school-based health centers. Cobrae and Lordsburg have sort of opened and closed a little bit. I mean, I don't know that they've ever officially closed, but they've had harder time recruiting providers to Baird and to Lordsburg, but HMS always does, or, you know, works really hard to do that. And in fact, one of our previous board members and good friend of mine, Susan Wilger, who used to be with your organization, Valerie, was one of the first coordinators I ever met, was on our board, helped us write our strategic plan. So we have a long relationship with your organization too. And I know in talking with HMS, they, prior to the state's influx of money this last legislative session, we were successful in getting the first ever operating dollars out of Congress. That goes through HRSA right now. And so unfortunately, it's limited to FQHCs. We think that's going to change if we can get Congress to be a little less dysfunctional. And HMS got a little bit of money. And I think Cliff and Gila had reached out to them interested in school-based health. So I know they had been talking to them, and I think they applied for some of those federal dollars, but did not get them. But they may very well reapply, because I think that money is going to continue. It may not grow until we have a little bit of less dysfunction, but right now I think it's going to stay flat. So there are opportunities there. And I'm going to call this out for Silver, but I think it's an exemplar of what might be happening in all of your communities that you could be thinking about, which is that things get so siloed. Because everybody is working so hard and has 5 jobs that they're trying to achieve. Silver Consolidated Schools got money through Senator Martin Heinrich through a federal grant program to do school mental health expansion. And I asked the folks who run the school-based health center at Silver School, did you know that? They said, no, nobody told us until Senator showed up at Silver High School. The principal hadn't talked to HMS. HMS didn't know they were applying. They didn't know how to collaborate, and they had it on their agenda to go talk to the school about that. But that happens all of the time, all over the state. And especially because school health is these two kind of fields that speak different languages and don't always have the glossary for one another. So I think health councils are really well positioned to help with that desiloization, if that's a word, and help all those community partners talk about it so that they're layering services to get the most bang for the buck as opposed to duplication. And I don't know that is going to be duplication. I think there's plenty of need to go around, but that's certainly a risk. Now, as an example of where things have been successful, I'm going to use Torrance County as an example. Torrance County participated in when Presbyterian funded some of the county health council surveys, assessments of healthcare needs. Torrance County and Valencia County both showed a need for school-based health, and Torrance has been working for years. Now, there's good news, bad news. So we did have in the closures back during the recession, Mountain Air School-Based Health Center closed, but there is funding in this year's new pool. Moriarty is going to get a school-based health center, and there's a lot of kids in Moriarty with a lot of needs. And honestly, the school nursing team at that school district just hounded me and hounded all of the county's healthcare providers until we finally just, through a charm and hassling offensive, made it happen. So they're going to be remodeling a portable that's going to serve elementary, middle, and high school in Moriarty, and PMS is going to be running that. And PMS was one of the partners that was identified through the County Health Council's original assessment years ago. Now, that's a long game, right? So that may not sound that encouraging to you guys, but I've been talking to the school nurses in Moriarty for 10 years about the needs that their kiddos had in that community. So for me, it's a huge win. And I don't know that all of those partners would have been connected if it hadn't been for the County Health Council's assessment. And I still have hope. Estancia school nurse calls me all the time. I'm still in touch with folks in Mountain Air. I think, long term, we may see some more growth there. So it's the kind of like chipping away at, it's not the magic wand and it happens overnight kind of work, which I know is hard to sustain, especially sustain people's morale and inspiration around that, but it makes a difference. I get sad because a whole generation of kids graduated from school in that 10 years it took us to make that happen. So I still am willing to fight for the overnight successes, but in the meantime, we also have to play the long game. I hope that answers your question.
Very much so. Thank you so much.
Okay, it looks like Joanne has her hand up as well.
Yes, hi, this is Joanne Palomino, and I do work for the New Mexico Department of Health, Southeast Region, and I just wanted to piggy bank off of John, what he had said earlier. just 2 days ago, we went to a meeting here in Chavez County, and right now we have 3 teenagers staying at our CYFD office because there's no place for them. So this morning I had to send out an email to everybody in our district or our DOH to see who would be willing to help take these teenagers food, because CYFD is so short-staffed, and their staff are the ones that are taking care of these kids and so forth. And it's just a sad situation on what we have to deal with here in Chavez County, along with our kiddos, third graders on up, vaping in every school. And our sheriff department, our police department, state police, even our school district, they're so overwhelmed with shortages everywhere. So it's like, what do we do? So I hear what John is saying, how everybody is short-staffed everywhere. And I know we can't be that superhero out there, but sometimes it's like, what's the next step? What's going to happen next, especially with the school-based school centers closing and shutting down, and the need for our community. And I'm sure there's other communities hurting as well, but I just want to throw that in. That's what we're dealing with right now.
And there is, Joanna, I want to flag this for you if you guys wanted to talk to either your SHMA or SHAW there. Both of them have been working with Office of School and Adolescent Health to try to, support the district and La Casa to bring those school-based health centers back. But also, and I don't know if the SHAWs and SHMAs would know about this yet, but Kristen Oreskovich is the school-based health center program manager at OSA, and she's been meeting with CYFD because CYFD has not been meeting one of their legal or / regulatory obligations, which is to make sure that once kiddos come into CYFD within, I forget if it's 30 or 60 days, they have to have a comprehensive wellness exam. And so DOH and CYFD are working together to try to figure out, what can public health offices do and what can school-based health centers do to kind of insert themselves. That doesn't help to house the kiddos, but at least you could find out if they needed immediate medical attention. So Kristen could maybe talk with you about that. I think she's like on a work group on that issue. And you may local perspective that would really help that work group.
Well, our nurse manager, Carol Lott, has reached out to me this morning. She goes, Joanne, I'm worried about the safety of the kids. Where are they bathing at? The employees, there has to be at least 2 employees staying with these kids at night, because you can't just leave them. And some of these kids have behavioral issues where, what if they accuse these staff members of anything? Anything can go wrong in keeping those teenagers in CYFD office. Right now our concern was getting them food, but maybe there's we need to also work on the safety of the students as well, plus the staff. But I'm sure that email that was sent out this morning, we have our 2, Marisa and Regina, that work with the SHMAs, so I'm sure they will be on it as well.
Well, the other thing we've been talking a lot about at our organization, and I think fits in with county health councils. There's no one resource in our state that's big enough to meet the need. So I keep thinking of a quilt. Like, we need all of us to be the patches in the quilt, and maybe county health councils are the thread that sews us together, because with your community as an example, maybe La Casa can do this, maybe the local community behavioral health clinic can take care of this part, maybe each of the partners that county health councils could maybe bring to bear, do a little piece, and you sew that quilt together, and maybe that quilt's big enough to cover those kiddos. And that is hard work. And I know county health councils do not get enough money for that work. We have certainly stood in support when you guys have asked for more funding for the Alliance and for county health councils, because putting partners together and building grassroots collaborations is hard work. But I Severino at La Casa can call and curse me out if he wants to, but I would say call La Casa and say, there's this gap, and we know you guys don't have $1 million or 1 million healthcare providers, but for these 2 kids, how can you help us? We would have sent them to your school-based health centers if they were open, but they're not open. So how can you help these kids? Tell us what you can do. And then maybe with 10 different agencies doing what they can do, you can make a dent.
Well, thank you. And then I do cover Lee County as well. And I know John and I were on a call a few weeks ago because Lee County is high in teen pregnancy and syphilis. Well, just 2 days ago, another teenager had her baby and dumped it in the trash. So this is in Hobbs, New Mexico, and you all could probably read up on their newspaper because it's all over. But we're also having to deal with that too. And I don't know much about Hobbs and Lee County and school-based health centers there. But when it's your county and you cover it, it's hard. It's very, very hard to hear stuff like that. So, and John, I mean, he's wonderful. Him and his new partner, Shara, I think it is, John, correct?
Yes, that's Sharon.
Yes. So they are working hard trying to get those numbers down with the program that he's with the SWAG program. But we're going to do our best. We're going to keep on working and doing our job.
Well, first of all, thank you. Second of all, I would say reach out to Norley Hospital. They do run the school-based health center at Hobbs High School. And shockingly, so they run Lovington and Hobbs. Lovington's school district does not allow them to provide comprehensive reproductive health care. And sometimes what that looks like is they can test and treat for STIs, but they can't provide contraception. It kind of depends district to district. Hobbs created that school-based health center through bipartisan community work, which is, I don't actually know off the top of my head if the county health council was involved in that, but Republican state legislator Gay Krause was involved in that. 2 or 3 community organizations were involved in that. The UNM Health Heroes were involved in that. And so that school-based, and part of the reason they all came together is because the teen pregnancy numbers were off the charts. And so they were able to convince their school board to allow for reproductive health care in that school-based health center. And I could have gone down to those school board meetings and they would have laughed me all the way back to Rio Rancho. It's when the community members demand care that is needed by their children and families is when you actually get that stuff to happen. Now, I will say, it's no secret to anybody on this call that your region, Southeast bordering Texas, is where those kind of issues are hardest to address. That's where we're getting pushback and misinformation is from the Southeast part of the state. So I know there's still stigma attached at the Hobbs school-based health centers to kids coming in there for reproductive health care, or even coming there for prenatal care. So I definitely hear from folks that that young women hide pregnancies when they should be getting prenatal care, which is another, concern for that child and family. So I think there's still more work to be done, obviously, in that community. And that's why you're seeing tragedies like that. But, when the previous incident in Hobbs happened, I think that was a dumpster also. And we have, safe surrender in New Mexico where you can go to a firehouse and surrender babies. But young people don't necessarily know about that. So, maybe county health councils can do education about safe surrender. Maybe county health councils could be talking about prenatal care. We partner a lot with grads programs that serve expectant and parenting teams. And I do not know off the top of my head if Hobbs has grads. I know Lovington has on and off. But those are important prevention and health promotion things that can be young people can be educated about that maybe don't get the same blowback from the community as we're going to provide condoms and contraception to prevent STIs and teen pregnancy. But it's no surprise to me that school-based health centers that aren't allowed to provide reproductive health are in the same communities that have the highest unintended teen pregnancy rate. That is not rocket science, which I am not a rocket scientist, but Carlsbad is an example further southeast where they have incrementally over time convinced that community to allow them to do reproductive health care because their on-campus childcare center at Carlsbad High School was bigger than some community childcare centers because they had so many pregnant teens. And that, I think, and the sort of the community concern over that issue is what turned the tide for them to be able to provide reproductive health care. So that I can't say enough how we don't have the spread or the capacity in our organization to maybe always make those arguments, but county health councils do, because you guys know what's going on in your communities. And you can, as I got accused, I was doing a presentation in Las Vegas, New Mexico, and they said they were going to start calling me Reverend Nancy because I was preaching the gospel of school-based healthcare. But we need as many partners to speak for children as we can, because children can't vote. So, every one of you who can talk about the need for school-based health helps us move the movement. That's how I see it. I don't see any other hands, and I know we're up against your time. So again, Nancy@namasbec.org. I know our acronym doesn't trip lightly off the tongue, but you guys are always welcome to email me if you have ideas or questions. And we're actually about to hire another person. We've been with funding growth, we've been able to expand our capacity. So hopefully we'll be able to serve you even more quickly as we go forward.
That is awesome. And I just put Nancy's email back in the chat. Nancy, I'll follow up with you about getting some handouts / resources and links that we can send out. We'll get those sent out next week, both in our announcements, and then they'll also be uploaded onto Mighty Networks for health councils to access in there. Any final questions, remarks?
Well, just thank you guys. I'm impressed on a Friday that this many people even come out. I really appreciate you. I know a lot of you are community volunteers, and I really, for one, value what you guys are doing. And I hope we can continue to collaborate in the future and help more kids in New Mexico. So thank you.
Absolutely. Thank you, Nancy. And have a good weekend, everyone.